Good evening, everybody. Imagine this. I'm sure we've all been in this position. You go to the dentist, you sit in a chair, dentist takes a look at your teeth, then you hear those dreaded words. You have a cavity. You think to yourself, how'd that happen? What is a cavity anyway? Well, today I'm going to go over that. I'm going to go over what a cavity is, how it forms, and how you can prevent hearing those dreaded words in the future. And here I've got a few pictures here for some goals for today. First, of course, is to keep your teeth looking nice and pretty like this. To keep from having to get an injection like this, and to keep your teeth from looking like that. So those are some things we want to try to look at today. Now, first we'll answer this question by going into how cavities form. What causes them? You know, the whole, what is it that makes a cavity? And then after that, how we can prevent it. Now, cavities, we'll look at it. Cavities are a disease. So let's look into how this disease is formed. First, we'll look at the tooth and the creation. What is a tooth? How does it all work? What is the tooth itself? And the tooth is made up of at least 3 parts when it comes to cavities. The first part of your tooth, the first layer of the tooth, is called the enamel. And that's the hardest substance on your tooth. It's just the hardest substance in the body. Really hard substance, almost harder than some bone. If you get a cavity in that area, you can probably get it to reverse or even heal up with some good fluoride and good home care. Now, if the cavity breaks through that, then you have into the dentin layer, which is a little softer material, very easy for the bacteria to get in there and eat away at. That's where you usually get your regular filling. You know, the doctor says you have a cavity, you get a filling. Now, if the filling the cavity gets too big and it gets into the next layer, which is the pulp chamber, that's when usually you'll end up with having to get a root canal, because now it's hit the nerve. You probably are feeling it, and you've probably made the appointment to see the dentist willingly. So this is definitely, that's an area you don't want to get a cavity in. Now, how does the cavity form? Well, first of course, plaque is the biggest culprit. And what plaque is basically bacteria and leftover food debris. Now, the bacteria basically produces acid. It eats the sugar in your mouth, produces the acid, and the acid is actually what's eating away at your tooth. It's not really the bacteria, it's more the byproduct of that. So now that you know how a cavity forms, let's look into how to prevent getting a cavity. Of course, the biggest thing is proper nutrition. You got to watch those sugary foods. Now, the bacteria, again, that cause cavities, like I said earlier, love the sugar. And that's what basically their main diet is. They eat that sugar and they expectorate acid, and that acid eats away at your tooth. So that's the cycle we want to stop. And you can kind of look at here on this little slide here. Plaque, again, it's an organized collection of bacteria. Now, the time plaque is left undisturbed in the tooth, that's the biggest thing. It's why you want to brush and floss, because the longer that plaque sits there and the acids are there, it's going to cause you problems. So how do we stop that? Well, of course, you want to brush, and I'll get into that here in just a few minutes. But you don't have to quit eating sugary foods just because of the plaque in your mouth. But what we do want to make sure you do is watch how much you eat and the quantity and the time. Okay. And again, you also here have a little thing here, a couple things. You got bacteria plus sugar equals acid. And that acid, of course, plus healthy teeth equals decay. And then the next layer of that is, it's not the quantity, it's the frequency. And it's the frequency. If you have one Mountain Dew and then the water next, that's not so bad. If you have a Mountain Dew and then 5 minutes later you have another Mountain Dew, that's where you have a problem. And every time you eat something or drink something with sugar in it, you're going to get about a 30-minute acid attack on your teeth. And that's where, tooth is strong, but after a while it can hurt it. Next, of course, we'll go into what can you eat. Okay, well, I can't eat the sugary foods, but what can I eat in place of that? And here's some examples of some things you can eat. We've got water, you got some good whole nuts, cheese, some good meats. So you got a whole bunch of food and water and stuff and drinks that you can have. And you don't have to, like I said, you don't have to stop eating or drinking what you love. Just watch how much of it. Now, let's go into, of course, the biggest thing, home care, brushing and flossing. Everybody knows about brushing since they were a little kid. Brush your teeth before you go to bed. Let me see those teeth. So we've all been conditioned to brush, but a lot of us maybe not doing it the correct way. And first off is the type of toothbrush. You want to make sure you're using a soft bristle toothbrush. You don't need anything harder than that, because if you do, you're just going to wear away at your teeth and your gums. So you don't need that. Just a soft bristle toothbrush. And you want to make sure that you're getting the entire tooth. A lot of people will just brush the tops of their teeth and think they've got it, but you also got to get the gum line and the sides of those teeth. So you want to make sure when you are brushing, it's your 45-degree angle along the tooth. You can see here on this little diagram here, you want a 45-degree angle so the bristles are hitting that tooth and the gum, and then soft circular strokes. So you're getting all that plaque off of the tooth. The next thing, of course, that people aren't so good at is the flossing. And you want to make sure that you're flossing at least once a day. And the reason is because you want to get that plaque that's stuck in between the teeth that the toothbrush just can't get to. And so what you want to make sure you're doing is you want to get that floss in between the teeth, and you want to wrap that floss around the side of the tooth so that you're getting the entire side of the tooth, and then just move that floss up and down so that you get all that plaque that's stuck in between there. And as you can see in the diagram here, that shows you, it kind of shows you want to make sure you're wrapping that floss around the tooth, and you want to get each tooth one at a time. A lot of people will just kind of pop the floss in and pop it out. When you do that, you're getting the loose stuff that's in between there, but that thick layer, that thin layer that's stuck along the side of the tooth isn't getting removed, and that's what causes the problems. So you want to make sure you're getting that off of there. And of course, the biggest thing, don't forget to brush your tongue. That's a lot of problem. People get bad breath and all that because they just don't brush their tongue, and it gets kind of nasty. So make sure you are brushing your tongue. Now, what else can I do to prevent getting cavities? Well, you got the brushing, you got the flossing. And another really good thing to work on is using Listerine rinse, fluoride rinses, and fluoride toothpaste. Again, fluoride is a very important thing. Now, the Listerine, I like to tell people, the Listerine will kill the bacteria. So that's one avenue. And then you go the fluoride, which helps to strengthen your teeth. And then, of course, you brush with the fluoride toothpaste also, another layer of fluoride. And that helps to keep your teeth strong and the bacteria level down. So that's a few little things I've gone over here just to kind of go over that for you with the brushing and the flossing. Now, in summary, I've gone over what causes a cavity, how they form, and how you at home can prevent yourself from getting a cavity. So hopefully you now have a better understanding of your role in preventing cavities. And if you follow these steps, you'll not only prevent yourself from having to hear those dreaded words, but you may save yourself a little money in the long run. Thank you.